Hello, friends. Greetings of the day. Here once again, your host. I am Dr. Neeraj Gupta, currently the chairperson of IAP Allergy and Applied Immunology chapter, is once again back with another scintillating episode of Allergy Legend. And do you know that who is with us today? Dr. Rajendra Prasad. Yes, Dr. Rajendra Prasad. The name in itself is an era in itself. He is a leading pulmonologist and respiratory and allergy specialist with nearly 5 decades of experience. After completing his graduation and post graduation from King George Medical College, Lucknow, he served as leadership position at King George Medical University, Lucknow, and Vallabhbhai Patel Chest Institute, Delhi. He has been Helm of Affairs at National College of Chest Physicians, Indian Chest Society, and American College of Chest Physicians. He has received numerous awards, among them B.C. Roy Award and Vigyan Gaurav National Awards are the prominent ones. Currently, he is the Director of Medical Education and Professor and Head of Department of Pulmonary Medicine at ERA University, ERA's Lucknow Medical College, Lucknow. Thank you, sir. Thank you. We welcome you at this episode of Allergy Legend. Thank you for your precious time. We welcome you, sir.
Thank you, Neeraj. Thank you.
Sir, it is an honor to have you with us on the Allergy Legends. To start with, can you briefly tell us how you describe yourself, not just as a doctor, but as a person?
At the very outset, Neeraj, and you and your whole entire team, I wish to thank you and give my best wishes for this, your activity, and for choosing me as a legend in the allergy. Well, if I can describe myself, I was born in a district Basti, a small kasbah in district Basti. My background had been literally a kasbah, you can say is a large village type. And my family, I belong to a business family. My father was not very educated. He was around, at that time, he was class 8th. But he was, I believe, what I have seen him, he was very intelligent and very laborious. These two things I have seen in him from my childhood. My family was combined, and believe me, Neeraj, nobody knows in that kasbah how doctors are made in India. I'm talking of 70s, 60s and 70s. I'm saying these words because my elder brother, who is no more, he was about 6 years senior than me. And he did MBBS from KGMC. He was selected in 1964 batch. And and why he was selected, it was wish of my father. Though he was a great businessman, and we both, I have 2 brothers and 1 sister, we both wanted that since we have a very good business in that area, so we wanted, why to study? Continue with this business. This is very lucrative to us. But it was my father who insisted on, first on my brother. Can you believe, from the Basti, from place known as Munderma, it is about 15 kilometers away from Basti. And he came with my elder brother to join him, to coach him for something which he found that how people are selected. And my brother got selected in the first attempt in 1964. That was the story, how our family came into the medical side. From the businessman side, it came into medical side. And now I can say, so I belong to a very, we were not poor, we were good businessmen, not having much of the education in the family, but it was my father wish and his intention that we should go out and study, and especially he wanted to make both brothers brothers and sisters as a doctor. And now I'm happy to inform you, our family is full of doctors. My wife is a homemaker, but my son is he is MD medicine. He is an additional professor in RML Institute in Lucknow. His wife is also dentist. My daughter is dentist. She did MDS, and my son-in-law is a cardiac anesthesia working in Max. Actually, currently he was in England. He just returned. But before going to England for 4 years, he was cardiac anesthesia in Max Hospital for Pargan, because they belong to Delhi. So that is my humble background, I must say, from which I have come.
Great, sir. Great. Means like it's very nice to hear all these words from you and knowing about your background, sir. So, do you think that if by chance you would not have got the chance to become a doctor, then you would have been something else, probably a businessman, sir? Or you see something else apart from businessman? What do you think, sir?
Well, if I had not been a doctor, then my another choice, it was not business, but it was something related to business. You know, I'm a very fond of I'm a foodie, I must say, and I have seen whole of the world how the foods are prepared,
Okay.
how they are served. This is my good fortune that uh, starting from a village, but now I have traveled whole of the world. So in my mind, my family members, my daughter, son, they say, "Sir, Papa, you are a very good cook." Not very good cook. I'm not a cook, but I can instruct, I can prepare, I can have an idea. So what question
Great.
is little funny answer for me, but I would have probably come into the hotel business, and probably and my thinking even from my childhood, if I have not become a doctor, it was my father wish I became a doctor. But then business, especially the hotel industry, where food, and my idea was how we can serve the food which is good for the health.
Right, sir. Right, sir.
Because hotel foods, they are very difficult to eat. They are very, I mean, so my idea was, sometimes when I help my wife, when my wife is a very good cook, so sometimes when I help, my children always say, "Papa, when you have your input in any food, food becomes very good." So that is probably the second choice. If I have to choose, probably an idea I have told you, idea was very different. I still talk a lot of lectures on lifestyle, what type of food, how you should bring, because lifestyle is now everything. Behind every disease, there is a lifestyle. So that was my idea. Why I was, if I would have not been a doctor.
I really like the way you described yourself, sir. So, what I understand that your initial days, the inspiration seems to be your father and probably the elder brother and the family environment, which I can understand. So, you started your graduation somewhere in 1970s, and then you completed your graduation in 1974. Sir,
Yeah.
at that time you chose this tuberculosis and chest department as a post graduation in somewhere 1975-6. So, what was going on in your mind at that time? Because, to my understanding, at that time it was not, you can say, like very well considered to be a very preferred choice. So, why you chose this field? What was going on in your mind at that time?
Neeraj very well said. When I completed my graduation from KGMC in 1974, and I did my internship in 75. In KGMC those days, there's nothing like this NEET or anything. Uh, For CPMT, for MBBS, there was a CPMT, but for the post-graduation, KGMC was a very alone medical college, one of the oldest medical college in the country. So they have got their own system of admission. There was a merit system, there was a process of making the merit. So luckily in my batch, I stood among top 15 students of the batch. And you said very rightly. So when it is 1976 when I completed my internship in 75. So my choice would have been since my brother was surgeon. So I decided that I will not go for surgery. I'll go for medicine or allied subject. And when I saw my merit, I could have got medicine, I could have got pediatrics, and I could have got, naturally, of course, if I can get medicine and pediatrics, those were the star subjects in those days. Topmost boys and girls used to join these subjects. But in my mind, it came sometimes, because, during MBBS, when I saw the cases of pleural effusion and something like this, the respiratory system was fascinating to me. Rather, I used to teach my own batchmates in final year about pleural effusion, mitral stenosis. I still remember. So my idea was that if I join this subject, which is not preferred those days, lowest merit. So my idea, what it came to my mind, if I can join this subject, in medicine, I would be in medicine, there was 11 seats at that time in 75 in KGMC. So I was number 3 or number 4. In pediatrics, there was 6 seats, and I would have been, if I have joined pediatrics, number 4. So in those days, this department was known as Department of Tuberculosis. It was not even chest disease. So, and that was not a preferred subject. Nobody wanted to go to that subject. But I took this subject by my own choice. And only thinking in my mind was, because I was, nobody had joined before me in that particular subject of such merit, which I had. So I took a calculated risk that if I can click in this department, and then I said I had some liking for the respiratory diseases. So that's why I decided to join. Interesting story goes with this. My batchmates, who are close friend of mine in 75, they started literally abusing me. मैं अगर हिंदी में कह दूं कि क्या राजेंद्र तुम पागल हो गए हो, ऐसे विभाग में जा रहे हो जहां पर मतलब हमारा जो मेंटर खन्ना साहब थे, he was American trained, he was a very strict, and in 3-4 years, one MD out of 5 MD candidates, one candidate used to get MD. Those are the eras I'm saying. So my batchmate become very angry with me, keeping my merit in mind, keeping my mentors, strictness on those days. So, but I took calculated risk, and actually, I must say today, if I am talking in 2025, that has worked for me, and that has clicked for me, real words, and you know that I have whatever I have to achieve, probably God has been gracious enough to give us, provide. And we are the one who, we started from tuberculosis, then it was converted into TB, chest disease. When I became head in 97, in 2004 or 5, I converted department pulmonary medicine. And what you see today, pulmonary critical care medicine, interventional pulmonology, allergy, whatever you see, this is literally, we have been contributed to a lot. What people say that really, these are the people who are really contributed. So in that way, I have no going back. And I still say my decision was, though it was not very proper, but it was very good. And I'm happy at this today that we have been able to contribute so much in the field of respiratory allergy and so on.
Great, sir. So with this now, let us focus more towards allergy. So I was now coming to this point that I can understand about your background of pulmonary medicine, chest medicine. Now, since when you are involved in the subject of allergy, and I'm talking about those days or those years, at that time actually allergy was something like people were not aware about anything. There were no courses, there were nothing which was going on. So since when you are involved, and how you got your first exposure to your training about allergy?
Well, Neeraj, I think very interesting question. And if I have to go back for this to 1973, exactly 19 when I was fourth year student in KGMC. And one of my colleagues, he suffered from asthma. So we got information from our seniors that in TB, in Department of Tuberculosis, there is an allergy clinic which treats such type of patient, and especially there is an allergy test there. So my class fellow was advised for the allergy test. So I accompanied him to the department. You know, Department of Tuberculosis, I said it was there. And as a fourth year student, I went with him. And I still remember Professor Jafar Jamil, who is no more today, and Professor M.S. Agnotri. They were the two people who used to, all the teachers used to run the allergy clinic. So allergy clinic was very well established in KGMC, I'm saying from 1970 onwards. So it was one of the very few centers in India. I think after Patel Chest, and then after Jaipur, some center in Jaipur, probably Lucknow was the third center KGMC where allergy clinic setup was there. As you said, they are very primitive. So I saw that when I went with my friend, Dr. Jafar Jamil was in OPD. We showed him. He said, "Yes, you require allergy test." I still remember very vividly. He injected those days. Intradermal tests were there, not the prick tests were there. So he performed about with 60 allergens, and he found that some of the allergens he's positive. So he was also given immunotherapy. Believe me, probably it will be a news for all the listeners. In 70s, we have a facility of collecting the allergen in the department and making because those days the rules were not very strict. So making the antigen for testing as well as for immunotherapy. And why this was available? Because I can share with you, Professor M.S. Agnotri and Professor Jafar Jamil, Professor P.K. Mukherjee, Professor Khanna, these were my mentors in the department. They all ran allergy clinic, and there was a rather one or two, I must inform at this stage, A.B. Singh, who is now a legend in the, he did his initial PhD work in KGMC with Professor Agnotri and Professor Jamil and Professor P.K. Mukherjee. When I was PG student there, and then another person who worked in that college was Dr. B.P. Singh, who is again no more. B.P. Singh was again, these are two aerobiologists of the country, who are very, very known, very famous aerobiologists of the country. I'm happy to inform, during my residency program, we worked with them. We saw how the antigens are, how the flowers are collected, how the antigens are made. So I think Jafar Jamil and Agnotri Saab, they were the forerunner of allergy clinic in KGMC way back in 1970. So that was my first exposure as an MBBS student. How this allergy is done, how the immunotherapy is done. I was lucky that I was a graduate from that place.
Well, definitely, sir. It's really amazing to know that nearly 5 decades you have just, I think, described in a few minutes. So I can definitely understand and assume that there must be several challenges which you and your team might have faced in the early days. So can you please let us know some of the challenges related to allergy field or allergy care when it comes like collecting the pollen, collecting, making the antigen, and then prescribing immunotherapy to the patient. So the challenges in allergy practice over initial few decades or initial few years.
So I can share my own viewpoint here. When I joined this department, and that time department was known as Department of Tuberculosis, but having an allergy clinic. So what we do as a PG during my residency, 3-year residency, rather 4-year residency those days, JR3, all the 1, 2, 3, and then senior resident. All the 4-year residency I completed there. And during I saw the working of allergy clinic. I learned a lot. But unfortunately, those there were very primitive days. As I said, we used to do intradermal tests. Even prick test was not. Later on, we adopted prick test in that institute also. But it was the intradermal test. And we used to, in our PG days, we had a competition. I must share with you that we have around 60 list of 60 antigens in our allergy kit on those days. This kit were partially made from our department, and then we are getting a lot of material from Patel Chest also. So that's why in 60 injections we used to inject in, at least I stood first. Sometime when we have competition among the residents, who can inject very quickly these intradermals. So I still remember I stood first, and then I injected those 60 injections in about 5 to 6 minutes. So then we were not knowing anything, how the immunotherapy prescriptions are made, because we were involved as a PG days only to just screen the patient, write the case sheets, and do the allergy test. Then we used to go to the faculty in charge, whosoever there, and they just they make prescription with their own knowledge, and then we have given with our own hands the immunotherapy also. Every twice a week, patient has to come, and most of the patient has to come, and who cannot come, so then we gave the vaccine with all the instructions how it could be taken by a doctor at local place. So that was the initial exposure. So what I'm trying to say, they were very primitive days. Here, if I little narrate my more experience, if you allow, I became faculty in 84 in the department after finishing my residency program. And when I became faculty, since there was allergy clinic, so my allergy clinic was also independent. Now I have to run I have 2 days OPD and 2 days allergy clinic. So when I have to run independently, then I learned about allergy. And in the meantime, what happened, some of my colleague was some CMO was in Bahrain. I was little becoming popular slowly and slowly. He requested me to deliver a lecture on allergy, how the allergy is diagnosed, how it is treated. So that's sort of a lecture. Believe me, Neeraj, when the request came to me, I'm talking of 1984, 85 max. I became very nervous because we only used to test since I was faculty in KGMC, very prestigious institute. So I still remember for whole month I read the I still remember that book. Green book was there at that time, Selden, with the name of Selden.
Yes, sir.
And when I read whole book, and then I prepared some notes. That notes are still with me. And you believe me, when somebody asked me to take a lecture, because that was first lecture in my life as an a faculty. So little nervous. Then I read completely for about 1 month. I made those days slide making was very difficult. Not like we have PowerPoint today. We have to go to the artist, we have to write it, then the photograph, then the negative photographs. So I could not, during that time, I was not able to make any slides. So I spoke extempore. So my first lecture was around 40 minutes extempore, how allergy is diagnosed, how it is managed. And I was, if I remember 85 those days, and those doctors now it is incidentally who invited me. Now his granddaughter is now doing MD with me. They belong to Bahraich, near Ayodhya. So his granddaughter is now pursuing MD in Era Medical College with me. So what I'm trying to say, if you work hard, so I still remember that green book Selden. After that, I read Middleton also, but the first book I read was Selden that time, a very old book. It was in our library. We took it from our library and read it. And people still remember that lecture. That is how people started recognizing me in the field of allergy. That was my first exposure. But naturally for that, this is for younger generation. It is not those days, nothing like internet, nothing like anything available. You have to read, make your own mind, and to speak. Speaking by slide those days was, making slides was very difficult task. So I just spoke extempore. And that was my first lecture. I'm happy to inform you by this time, I have delivered more than 2,500 lectures, and many of them in the allergy also. Although many of them are respiratory diseases, but many of them are in the field of allergy. That is how I have learned allergy. I have seen in those days, since our people used to collect the pollens, so we started recognizing pollens. That is why in my lecture, when I take history taking, I say you have to recognize fauna and flora around you. And when they flower, that you have to recognize, and that is their pollen calendar. You have to not mug up. Today, I'm happy that there are books after books of the pollen calendar, but those days, nothing like pollen calendar books. So we have to see ourselves. And I used to teach my students every day. A small story I'll tell you. In my OPD, in TB chest, TB chest, later on this department was turned into TB chest. When any PG used to enter in our OPD, there was a neem tree in front of our OPD. And my first training to PG, which they still remember, when they come to my OPD or in allergy OPD, I ask them, what is this tree? So unfortunately, many of the students, they have not recognized. Although when they come to OPD, if they come in the month of March and April, a lot of flowers on the ground. So they just come over those flowers. I said, could you recognize what is this tree? So they were not. So I said, we knew this is Azada. This is a neem tree. Neem people used to tell, but its botanical name, they are not tell. I'm going to see your allergy kit. It is one of the allergen which we test. And this is how you learn. You have to learn a pollen calendar. If this snow is the month of March, month of February, March, if there is a flowering in the tree, that it is an means anemophilus type of, sorry, anemophilus, wind pollinated tree. So the pollen will spread, and this is what is known as pollen calendar. Because in history, you always say it is not only test. You have to take a good history, and you have to correlate with the history. So all what Neeraj I am trying to say to you, all we have learned by own. Nothing, no pollen calendar book was there. I made my own pollen calendar only by whenever I used to visit any village, any place, then I used to see and used to ask the local people what this tree is. What do you say this name? Like a acacia. So many trees are around us. So I always say, even today I say, if you want to become a good allergist, so what you said that what were the issues? Issues were a lot. Another issue in allergy, what I saw, nobody used to believe allergy, especially the physician. They say, what is this you are? What this you people are doing? So slowly and slowly what we had now I think awareness and knowledge and health education has much increased. Now we have not, because in KGMC, you can remember in 70s, there was allergy testing. Nobody used to refer. Only the patient used to refer the patient. Even my colleague just heard from anyone, if you are suffering from asthma, why in KGMC there's a TB department where allergy workup is done. So that is how he got this information. So lot of challenges were there initially. But I must salute to my mentors, my teachers, especially Dr. Jafar Jamil, Dr. M.S. Agnotri, my head, Professor Khanna, Professor Mukherjee. I salute to them. During 70s, how they worked with these allergy clinic. And that has another point I would like to, that has trained many allergists of the country, I must say. And many of the allergy clinic are manned by the persons who have been trained from our department, especially when I became, I joined, I became head in 97. So we took a lot of interest to further propagate this allergy knowledge and allergy testing, and we used to be very judicious. Initially, whosoever used to come, because very few patients used to come. Whosoever used to come, they used to be tested. But when I became faculty, I made it a point that unless you evaluate the patient thoroughly, and unless he needs allergy testing, you will not do. In that process, Neeraj, I coming to my mind, one of my patients who came to my OPD and literally started fighting with my PG student and including with me. He said that some doctor has referred me for allergy testing. Why you're asking these questions? Your job is to do the allergy test, what I have been told. So then I intercepted at faculty because he was not listening to the PG student. He was not even ready to tell us what is your symptom. So I said, listen, whatever you are, I agree that your doctor has referred for allergy testing. I agree with this. But then we have to evaluate whether you really require what your doctor has suggested. And why we are evaluating you, because sometimes in allergy testing, there are minor reactions we have seen. So until ultima, if I do allergy test, our clinic will do allergy test, responsibility is ours. So we have to see very clearly, and believe me, Neeraj, I would like to share with you when that patient was thoroughly evaluated and when we auscultated the heart, that was my very good teaching in OPD. Even if you are not auscultating the lung, you must auscultate the heart. So I found that there was a murmur of mitral stenosis. So literally, it was a case of a mitral stenosis, but having some breathlessness, So somebody thought that this is maybe the asthma, and so that those days I'm sharing these in 90s. That such, but in our allergy clinic we were very strict. Until unless we'll evaluate, we see that you really require these tests, then we used to perform. And then for immunotherapy, we used to give immunotherapy also, but we were very judicious, and that is how, because we were working in the medical college. Our job was to teach others. If you are not doing good, how you are going to teach other? How the next generation will be produced? That was my idea. So in medical colleges, we always say, whatever you are doing, you must be doing perfectly. You must be doing as evidence-based. Although evidence-based those days were not very popular, but now it has become very popular. So what is true, we do that. Then you will become a champion. Then your allergy clinic will become popular. If you don't follow these rules, probably I just narrated you one of the example. Even even in on our OP, many of these scabies patients, they come for allergy testing, thinking that this is urticaria and whatnot. Then when we evaluated, we found that those experiences I'm narrating you of 70s, 80s, and late 80s.
Great, sir. I think these are the great insights which I can still remember. I was like born in 79, and I can just imagine that what you people have really gone through, which type of phase. So, like, I understand that when all these things started somewhere in 80s and 90s, the things were very primitive. And at that time, even the physicians and the general people, the public, patients, they were not very well aware about that. Sir, how you see that this specialty of allergy itself, the awareness about specialty of energy, how it is going through over past 3 decades, and now we are sitting in 2025. So you told that from where it started. So how do you think that the awareness has now grown up till what extent and where we are now?
Well, I said awareness is increasing, no doubt about it. And awareness is increasing, and then has increased to large extent. But still, when we attend conferences, there are many two groups of people are there. One opposing the allergy workup and the immunotherapy, and another group is proposing. But now I think since it has become evidence-based, as you know, the GINA guidelines has also recommended, all the guidelines have recommended what is the place of immunotherapy. So now the acceptability is slowly and slowly increasing. But what I say will repeat here, until unless we wanted person like you, Neeraj, I'm saying in front of you, we want scientific people. We do not want, don't want that. One of the patient I remember, Neeraj, you will surprise. One of the patient came to me of something like of allergy patient, and I asked him, did you have X-ray? Did you have any investigation? But he came with the allergy report. So people are not, but now I think people are not investigating in all the aspect and then going for allergy test. That is must. So I always say you must thoroughly investigate the patient, thoroughly examine the patient, thoroughly take history. History taking, you know, is very important in allergic patients. So I always say many of my allergy immunotherapy workshops at Patel Chest, I usually they give me the to talk about how history could be important. So I always have said that history is a very important in allergy practice. But now I think that slowly and slowly, as you said, the awareness is increasing. People are going for it. But I always caution people that if you don't do the right thing, if you don't do the evidence-based thing, it will come to disrepute. I must say here my very pet sentence is why allergy came to disrepute. Only it came to disrepute because people are not doing properly. Wherever it is indicated, it is not that they are doing properly. So, if you work thoroughly, if you evaluate every patient, do wherever it is required, do whatever is required to diagnose allergy. I'm pretty sure what I have learned in last 5 decades, literally 5 decades. It's a good science. It's a good subject. And if you really work well, evaluate well, and then do all these things, probably the results could be wonderful. That I used to see in many forums, even in API and many other forums, I used to tell them. But provided working is there, quality of antigen is another issue, which is in India. Most of the people, they test with the Western antigens, which may not be good for our country. So we need such type of things where good quality antigen for testing and for immunotherapy probably will require. That is the future I'm talking.
Sir, absolutely well said, actually. And I also realized, and we all speak about that, that nowadays the time has come up for shortcuts, and success cannot be come in shortcut. You see, there are so many people who just want to probably hear one lecture, and then they want to perform skin prick at their own place, at their own pace, speed. Then they want to start on biologics. They want to jump to immunotherapy. So they do not want to spend time with the, you can say, like with the patient or with the specialty, and it is really becoming a little hard thing, actually. So the good things are coming, awareness is increasing, the things are becoming better, but simultaneously the patience among the doctors, patience among the parents and the patient itself, that is getting lesser and lesser. And the people are actually looking for the shortcuts, and then you can say like the Google and probably the chat GPT and different other type of things, so which are probably not the right way of achieving the success which you have just told us.
One thing, Neeraj, I forget. You asked about my training. So initially I was trained here in KGMC itself, from my student days to PG days to faculty days. Then I think in 90s I got training from Patel Chest even, because I know that if we want to do this, probably we need some certification. So I went there, and interesting story I may narrate you. I joined, well, maybe in 90s I was maybe associate professor in Department of TB and chest disease. And when I went to Patel Chess, all the people in Patel Chess were a good friend of mine. So when I entered into, I went little late from Lucknow. So when I went into the where lectures were held, and Dr. Gaur was taking the lecture. When Gaur saw me in the coming in the room, he left the lecture and he came to me and he embraced me because we were good friends since then. So I said, Dr. God, don't do this. I am one of your student. So what a student will feel. So that was the story. But I thought that a good training and good exposure of things. Then I was in Japan in '89 and a very early age when I worked although worked in a chest hospital, but I had some facility of allergy there. So sometime I learned there also that how allergic reactions were there. They were very advanced. So those were my training backgrounds, which we see. Otherwise, we are learning by ourselves, reading the books. And I quoted Selden. Another book I read is Middleton, which is now Bible of the allergy, people say. So those were the days. So you have to be work very hard. What I'm trying to say, you have to work very hard if you want to learn any subject.
Absolutely, sir. And here comes now the question that you told about your journey, that which hardships you went through, and now you have achieved a certain level, a certain authority in the field. And I must say, now you are the mentor of the mentors. So, my question to you is that how do you see as a role of mentor like yourself in shaping the next generation of allergists? What do you think that you would like to advise them? What do you think as a mentor for the next generation of allergists?
What I always say that keep up to date. If you want to acquire any field, keep up to date. Whatever things are coming, read every guideline, what they are saying, and then you get a training from places where good trainings are there. There are many places now where trainings are happening. Although we don't have any official training or by MCI, I will talk if you put allow me to ask that why there is no diploma, though no MDs. So that should be the idea. But if you maybe in the end you may put a question, I would like to reply. So we need a good whatever places are there, recognize the place and be be there as a student, try to learn what is happened. That is one thing, and then try to read that what innovations are coming. There are a lot of innovations are coming in allergy also. So all the things you have to read if you really want to practice an allergist, a very established allergy practice. Then you will become a champion. Otherwise, as you said, the shortcuts will not work, especially in allergy. So you have to choose places where you go. I myself took multiple training at multiple places. Though I had a good allergy clinic in KGMC, that was my initial exposure, but I took. And then reading is another method. All the guidelines, whatever new, and we are in medical college, we always say that in our seminars, whatever guideline, like say, for example, TB guideline was updated this year, a few days back. We had a seminar in our PG classes. So everything, whatever has come, whatever has, since we are talking allergy here, whatever has come in allergy, you have to go through all those newer things, newer guidelines, so that update yourself and we will be updated yourself. Definitely you are going to become a good allergist.
Great, sir. So you have actually highlighted the importance of training, and you rightly mentioned that currently we do not have any certified program by Medical Council of India. So suppose, let's assume that you have been given a task that okay, you have to design an ideal allergy training program for the country. So, what are your thoughts about an ideal training program for allergy in the country?
You know, allergy and immunology is a multi specialty program. First thing we have to understand is it involves chest, it involves ENT, it involves skin, it involves immunology, it involves microbiology. So a lot of departments are, it is a multidisciplinary subject. So for any training, and I believe when I'll go later on, but I believe we tried our hard, we tried our best. When I was I wrote an editorial, I think in Indian Journal of Allergy and Immunology those days, and asthma word was not there those days. In 2000, I believe in 2000, I wrote an editorial, need of allergy as a separate specialty. And on that mindset, I am working also. And when I was Director Patel Chess, we have already approached on those days, MCI was there and MC was not there. So we approached and they have probably agreed for diploma, starting a diploma initially, but unfortunately, I still ask Rajkumar many times that please go ahead and see that, because you know the first training, if anywhere it can be started in the country, I believe Patel Chess would be a most acceptable choice because it runs allergy clinic from the era of Dr. D.N. Sipuri, very old era. So very popular also. And I think Dr. Rajkumar is trying hard to get something, some education. And pending that, I think pending that till we get that. But that training would comprise of rotational posting involving many departments, exposure to all the departments, and then this is a pollen botany is one of the another department where you have to be some exposure. So it is always a multi-specialty choice, and then any center can develop like this. Although every department cannot be, but it is possible in medical colleges where all the departments are there. They can coordinate, they can cooperate, and develop a program which can train people who are interested in getting some fellowship. I think some fellowships in the country are going at present, and where they are doing all these things. But that has to come at the recognition level. As I understand today, there is nothing like an official recognition of these trainings. Like Patel Chess runs a 7 days. I used to attend even my during directorship. I have conducted 3, 4 those training. So, but that has to be recognized so that people can get its recognition. So, training is a very vast. It is a multi-specialty training, multi-dimensional training involving all things, and newer things are also coming. The component result diagnosis for last 4, 5 years has come. We hardly we understand very little about component result diagnosis. So probably a lot of work has to be done. Probably Indian work has to be done. The how we can understand this component result diagnosis, because ultimately that will refine the subject of this specialty. So all sorts of combining together all things, and that will be part of a good training, good curriculum for any training in allergy specialty.
Absolutely well said, sir. And I usually say that we have to really shackle all the boundaries and we have to really see everything, because allergy is a systemic disease. It is not related only to a particular organ. And even the quality of life of the particular sufferer and even the parents or the caregivers, they are also very well affected. So we have to really see, you can say, like from every possible aspect point of view, when we have to really go multi specialty point of view. So absolutely well said, sir. So now going beyond, sir, so we are now sitting in 2025. The way you describe the things over past 4 decades or 5 decades, what do you think next 5 years, 2030, where we will be, or what we are looking for, or India is looking from the allergy practice point of view? What do you think that India will be there in 2030?
I think the future is very bright. That is my first sentence in India as far as allergy is concerned. But we have to work very hard. I think some training, good training, some recognition to the allergy training. And another issue that I already touched, that we have to be like we used to run a biochemical center of CSIR in Patel Chess, with when they used to produce the local allergens, because antigen, quality of antigen, very few companies are there in India, and especially we are interested with the Indian antigens, not with the Western antigens. If you see, these people are doing IG, specific IG for 100, 200 things. Many of them are not relevant to our country. So probably we have to work on that direction. Quality of antigens we have to work, which can work, which can we can for use for testing and use for immunotherapy both. And the future, another thing, I think the component result diagnosis. We don't know what is in our Indian standards. What we are seeing is mostly on the Western part. What is the Indian, how we behave in a component? So those things probably but I see, let's put a question, what is the future? I see future is very bright. And if I can find, Neeraj, I'm not saying in front of you, if I can find, if you can multiply multiple Neeraj in this specialty, probably the future is there. But I still believe the future is very bright. Younger people are coming. They have a lot of enthusiasm, lot of interest also. They will definitely, our days are now, I always say, अब तो हम लोगों की शाम हो रही है, समझिए, अब जनरेशन नीरज आप और आपके जैसे लोगों का है. So I only suggest you. I know that you are a very hard. I know you for last so many years. You're very hard working. So such type of people are required. But I still say, I finally say, future of allergy is very bright. Good,
Thank you, sir.
few
Thank
of
you.
the things which I say, quality antigens, and then good training facilities, some recognition by an MC. These things will be there. Probably, I see the future of allergy is very bright.
Absolutely well said, sir. So we are now coming to the far end of your interview. I will be just asking you few questions which are a little rapid fire. So I would request you to be very brief, like one word or probably a line in the answer without any explanation. So what do you think a myth about allergies which is very common and you would like to bust that?
Well, a myth about allergy, what I'll say here also. Immunotherapy is very effective, provided if you choose a right person and right quality of antigen, then this is a myth that this is not working. It works. I have seen in last 5 years.
Absolutely, sir. Absolutely. One allergy test or allergy tool in your clinic which you absolutely trust.
I still trust the skin prick test, but it will always be correlated with the history to pick up a good the antigens, proper
Absolutely, sir.
antigens.
So basically, allergy is actually history. You have to go dig into the history, deep into the history,
Yes.
and thereafter you decide. Sir, one clinical pearl that you wish you would like to give message to every allergist of the country. One clinical pearl that okay, you should know this one thing.
Well, I see a lot of patients of asthma. I have a lot of interest in ABPA. I have couple of more than 500 cases currently with me with ABPA. So people are underdiagnosing. What I say that, and I used to say today that every patient of asthma, especially the chronic asthma, severe asthma, they must be evaluated. I know that when we started working in ABPA in 80s, there's nothing, these tests were not commercially available. Now every test is available. It's a possible. So every patient of asthma, my suggestion is they must be ruled out for ABPA.
Absolutely, sir. Sir, one allergist in India or abroad which you admire, but not yourself, other than yourself.
Well, in India, I have, although I have not very exposed, but I have heard about D.N. Sivpuri Sahab, and then my own mentor, Professor Agnotri and Professor Jameel. I admire them in this field. And another person in field of allergy I admire is Dr. A.B. Singh, who, although we work together, but I still admire him. He's a great aerobiologist, and I used to say his another name is not A.B. Singh but aerobiology Singh.
Great, sir. Sir, any particular book or quote or philosophy that you feel that keeps you motivated, that guides your practice?
Well, what I learned from my father that hard work is very essential for anything. So I always say my students, please be hardworking, be honest. And the third sentence I use, which now my PGs used to say in front of me, sir, you told us, don't follow the money, money will follow you.
Well said, sir. Well said. I think this is the right thing. This is the one crux which you have made that you just follow the quality and rest everything will fall in place. And if you follow the money, then nothing will fall in place and you will even not get money also. Absolutely well said, sir. So thank you very much, sir. Thank you for sharing your wisdom and journey. Before we sign off, any message for young allergists or a wish for the future of allergy care
One
in
more thing
India?
I would like to say
Sir,
about
please.
the international exposure. You probably, one of the person I admire most is Dr. P.K. Vedanta.
So
And
Dr. P.K.
another
Vedanta is
person
guru
which
to so many people, sir. He is
which
known
I
to so many
started
people.
because Tiki Vedantan I know for last maybe 30 years. Wherever I have been there, in KGMC, in SAFI, in Patel Chest, in Era Medical College currently when I'm working, every place he has visited many times to us. So we work together. So I admire him. He's the one person who's really propagating allergy like anything. And another person I'm saying in front of you, in younger generation, I admire you.
Arre, sir, thank you, sir, thank you for all the blessings. So I think it was a really wonderful that we have you here today with us. We understand that it is very precious time for you, but still you find out some time for younger people, younger generation, and upcoming generation for the best benefit of the specialty. Thank you very much, sir. Thank you. So
Thank you.
with this we come to the conclusion of another episode of Allergy Legends, and I will make you sure that the next episode we will be having another legend, allergy legend with us. So till then, please stay tuned. Jai Hind, Jai Bharat.